Like TB, another contagious disease, that is leprosy. Leprosy also known as Hansen's disease, and you have to remember this name of the leprosy. Contents, definition, etiology, sign and symptoms, pathophysiology, management, and some questions you have to know. Then in leprosy, what do you mean by leprosy? And leprosy is an infectious disease that causes severe distinguished skin sores and nerve damage in the arms, legs, and skin areas around your body. Then and for leprosy, that is Mycobacterium leprae, like TB, Mycobacterium tuberculosis, leprosy, same microorganism is there, Mycobacterium leprae, and it is one of the acid-fast raw-shaped bacillus. And you can identify this Mycobacterium with the stain gel Nielsen. Some clinical symptoms, sign and symptoms of leprosy. There, in skin, sores will be there, rashes will be there, or like you can say some macules, papules, nodules, something will be there in skins, and that will be hypopigmented, sometimes reddish, and in nerves you will get thickened nerves, loss of sensation, there will be no sense, muscle weakness. You can classify leprosy into different types. That is indeterminate leprosy, tuberculoid leprosy, lepromatous leprosy, borderline leprosy, that are borderline tuberculoid leprosy, borderline leprosy, and borderline lepromatous leprosy. This type you can remember this, but broadly it is not necessary to this type you can remember. Here you can remember that is tuberculoid leprosy comes under pathophysiology, and borderline leprosy it is multibacillary, and again lepromatous leprosy it is also multibacillary. These three things you can remember: pathophysiology leprosy, multibacillary leprosy, and multibacillary. In pathophysiology, tuberculoid leprosy, and multibacillary lepromatous leprosy, and borderline leprosy. You can remember this in MCQs, they may ask. And for leprosy, that is Mycobacterium leprae, like TB, Mycobacterium tuberculosis, leprosy, same microorganism is there. And in mode of infection, or you can say the pathogenesis, how it can be communicate with other. Leprosy is slow communicable disease, and incubating period is between first exposure and appearance of signs of disease. It can be during incubation periods of leprosy, Mycobacterium leprae in body, there may be chances of, you can see the symptoms, and you can see how this leprosy is transmitted from one to another by direct contact, or by maternal-fetal transmission, or during birth, or you can say during you can transmission from milk, from mother to infant, lactating period. This leprosy can be transmission. You can see nasal oral droplets through nasal oral droplets, coughing, sneezing, or dermal inoculation, or suppose injection is giving or injecting some things, that with the help of same syringe. This time also leprosy. And main important test for leprosy is lepromine test. Like TB test, there will be tuberculin test and Montauk's test. In leprosy, you will get lepromine test. You have to remember this. And some medicines are used for the treatment of leprosy, that antibiotics are used, and dapsone is the primary drugs used for the treatment of leprosy. Like TB, isoniazid will be the primary drugs. Like tetracycline also used Rifampicin is the same drug. It is used common drug used for the TB and leprosy. You will get MCQs like this. Which of the following common drugs used for the treatment of leprosy and TB, and you have to give the name rifampicin. And for leprosy, that is Mycobacterium leprae. Like TB, Mycobacterium tuberculosis, leprosy, same microorganism is there, Mycobacterium leprae, and it is one of the acid-fast rod-shaped bacillus. And you can identify this Mycobacterium with the stain gel Nielsen. In some complications of leprosy is there, like infertility may be there, kidney failure, nose bleeds, muscle weakness, hair loss, and inability to use the hands and feet. These are the some complications may be caused due to leprosy. And that's all. If you know tuberculosis and leprosy and tuberculosis is same disease, both are contagious disease, and positive microbes is same, that is Mycobacterium, and some symptoms is different, and treatment regimen also same, 50% same, but here different based on types of leprosy treatments is given here. And so these are the simple topics you can know. If you read once, you can know this both. So that's all about leprosy. Thank you.